Good evening, everybody. It is Tuesday. I never know the date. This is terrible. I should always check the date. Let me just check. What are we? Tuesday, the 17th of January. Here we are. A couple of weeks into 2017. Hope this year has started off brightly for all of you. I've seen my first person's joined in, and it's Nilesh, my good friend. Hello, buddy. How are you? Hope you're well. The first shout out of the day goes to Lucy Lincoln. Hi, Lucy. Thank you for logging in. I understand Celebrity Big Brother is on tonight, and it's an eviction. So I'm assuming a lot of people are going to be watching that instead of watching me. But it's nice to have you with me. So we've got a few people getting in already. Ridwan, Lewis, Heather Osborne. Hi, everyone. Thank you for joining in. Evelina saying hello. Jade Holiday, hello. How are you guys? Right. So tonight, I actually don't have anything specific to talk about. So I'm kind of hoping you guys have some questions, or you've got some things you want to ask, or you've got some things that you're worried about, and we can actually do something about teeth. I've got a message from Courtney saying, hi, hope you're doing well. Thank you, Courtney. I'm very well. Abby Dorothy McLean, been waiting for this all day. Thank you, Abby. Nice to have you along. It's nice to know I'm appreciated. Thanks very much. Cassandra saying hello. Deepa saying hi. Rachel, Marianne Digby saying hello. Can you say my name? Evelina. I can't say your surname. I mean, Danilovich. That's not bad, I'd say. Evelina Danilovich. Hello. How are you? All right, good evening, Dr. Singing Dentist. That's from Pete. How are you, my friend? I'm watching both, says Connor Wright. So I'm guessing he's watching Celebrity Big Brother and hashtag Tuesday. Nice one. Multitasking. It's a bit difficult for us guys, but well done to you. Scott Gallia saying hello. Big up the Singing Dentist. No, right now. Thanks very much. All right, Cherie saying hi. Anisha's just joined in. How are you? Beverly Bob Johnson. You, without a doubt, are more entertaining than Big Brother. Thank you, Beverly. Big shout out to you. Hey, dude, what's the next song out? Yes, I'm working on it. Actually, I've written it already. I'm just going to put it out maybe in a week or so. It's going to be Fresh Prince of Bel-Air. You guys said it. I asked you guys what you wanted. Did you want Fresh Prince of Bel-Air parody, or did you want Jump by Criss Cross parody? You all chose. I think Fresh Prince got like 170-something votes, and Jump got like 20. Or something. So I think it's going to be Fresh Prince of Bel-Air. And it's all about fresh breath. And I can make sure when you go, hi, you don't knock people out. That's what it's going to be. All right, let's get through some of these shout-outs. Rachel, Marianne Digby, again, is asking, how much do you charge for an apicectomy? Wow. I refer those to my surgical colleagues. People like Dr. Nilesh Palmer. Check him out. Another friend of mine, Dr. Avik Dandapat, he's also a very good surgeon. So yeah, I don't really do apicectomies in practice myself. I like to refer them to people that are better at it than myself. Hannah, hello, what did you have for dinner? I'd rather not say. It actually was quite nice, but I'll let you guys guess. Guess what I had for dinner, and I'll let you know. Lewis Priddle is saying, I'm playing you out loud. Can you tell Lewis's mum to go to the dentist, please? Lewis's mum, can you go to the dentist, please? This is great. See, Lewis is inspiring his mum to go to the dentist. I love that. Thanks very much. Brandon Wilkie saying, hey. Umar Mural is saying, can I ask you to shout my name out? Shout out, Umar. Yonsei just logged in. How are you? Long time no see. Hope you're well. Shout out to all the dental hygienists, please. Big up the hygiene massive. Yes, big up dental hygienists. They help us dentists out a lot, and they're a valuable member of the team. Same with therapists, same with nurses, same with practice managers. It's a team. There is no I in team, although there is me. Anyway, so big up all the crews. How often do you do a 6-point pocket chart when a patient has BPE 3 or 4? Wow, that's a very deep question, and it's asked by Deepa. Deepa asking the deep questions. Woo! I'll tell you what, I will private message you, because some of the general public will have no idea what I'm on about 6-point pocket chart and a BPE 3 or 4. So I'm a private message Deepa with the deep questions. Deep. Right. Okay, I'm having my wisdom teeth out and I'm really scared. How do they do it? Well, Georgia, are you having general anesthetic or are they doing it while you're awake? It all really depends. If the wisdom teeth are a bit impacted and that means if they're stuck underneath your gums and they're stuck in your bone, it can be a little bit more tricky. So they may want to do it under general anesthetic. Again, a lot of my surgical friends will do that kind of stuff. Maybe not impacted stuff, but wisdom teeth can sometimes be half through. We call that partially erupted. So that can be a little bit easier, takes a bit of surgery. So it all really depends how bad the tooth is and who's doing it for you, really. But look, it's done a lot of the time. There are risks, but there's also a lot of benefits. You should have a good conversation with your dentist or your surgeon. They'll be able to talk you through everything. And every case is different. So even if I was to tell you, it's really fantastic, it may not be so fantastic. If I say, oh my God, it's horrible. You speak to people, some people have great experiences, some people have bad ones. So it's different for everybody. Don't listen to anybody else. Have a chat with your dentist or surgeon and they'll be able to tell you. That's great. Okay, watching from Australia. That's from Amber. Wow. Thank you for logging in all the way from Australia. What time is it in Australia right now? Let me know. Sharpie's joined in. How are you, Sharpie? Long time. Hope you're well, my friend. Damie is saying, how are you, seeing dentist? I'm very well, thank you. Doing all right. Mustafa is also shouting out Nilesh. Yes, he's a nice guy. Turaj Jun. Hi, Milad Jun. How are you? Very well, thank you. I'm Turaj. Nice to see you recently. Okay. Hi, I'm watching you from Baghdad. Wow, that's from Hajer. Hello from Baghdad. Wow, it's unbelievable. International. I always say this. I'm so happy and pleased and grateful that you guys tune into this on a weekly basis. Thanks very much for the support. I appreciate it. Okay. Kaylee is asking, I'm going to the orthodontist tomorrow for a consultation. Is there any difference between invisible braces and the metal train track ones? Yes, there is. One of them is invisible and one of them is the metal. No, so yeah, apart from being fixed, so the metal train tracks are stuck on your teeth. The invisible braces tend to be aligners that you can sort of put in and take out. I do a lot of aligner treatments. I use an aligner system called SmileLine. They're UK based and they're very good. And I also happen to teach for them. So yes, there are differences. Some people find the aligners a bit more kind of easy to get on with because they're not stuck on the teeth and you don't have to kind of watch what you eat and stuff because you can take them out. Brushing your teeth is a bit more straightforward. But they can't always do all the things you need doing. They can do quite a lot, but sometimes you just have to have the train tracks because your teeth need a lot more work and it might just be easier to do that. Ultimately, it comes down to who you're seeing and the skill set of your clinician. So some people are really good at getting fantastic results with the invisible aligners. Other people are just a lot better at doing it with train tracks. So have a conversation with the person you're seeing, see what's going to be the best thing for you, and also cost. Some things are a bit more expensive, other things are cheaper. So see what works for you, see what works with your budget, and have a chat with your clinician. Hope that answers your question, Kaylee. All right, Daisy Jarrett saying, hello, my favorite dentist. Thank you, Daisy. You're very nice. Say my full name out loud, please. Daniel H. Hottie. Is that really your name? Nice surname. Shout out to Dylan and Alicia. Big up Dylan and Alicia. Also, I have to shout out someone, Spencer. Big up Spencer. He went to the dentist and he was really, really brave and he's 10 years old. And big up Ruth. Thank you for staying in touch with me and telling me all through your dental journey. And I'm pleased that the Singing Dentist has managed to help you guys on your journey and getting to the dentist and being all brave. So I really, really appreciate the feedback you've been giving me. And big up Spencer for being so brave at the dentist. Well done, young man. Okay. What have we got? Where are we? Right, I need to catch up. There's so much messages, guys. It's overwhelming. Every time I come on here, I always say I'm going to do 15 minutes. It's been 9 minutes already, and there's still hundreds of messages coming in. I don't know how I can get through all this stuff. One thing I will do, though, I'm going to show you guys something, because I had a question last time. Did you ever have hair? Well, I'm going to show you a picture when I had some hair. Oh, yes. Wait for that. Okay, let me power through these things. I'm going to do very quick 2 minutes. I'm going to go through all of the previous posts and I'm going to try and batter through them. And I've got my electric toothbrush as my timer. So I'm going to go 2 minutes. I'm going to shout out. I'm going to read out. I'm going to answer messages quickly because I'm behind. Here we go. Ready? 2 minutes have started. Okay. Nahida, big up yourself. She wants to shout out. Nyla, good evening. How are you? Kelsey, all the way from Michigan, USA. Thank you, Kelsey, for logging in. Paul Flynn from Liverpool. Hello. Scott Gallia, I can't afford to see the dentist. Scott, I'll come back to you because there might be ways that you can. Hello from Algeria. That's from Hinder. Big up yourself. Thank you. Kathleen, is mouthwash necessary? Not necessarily. I'll come back to that a little bit. Mouthwash. Okay, mouthwash and paying. Nabila, That's 30 seconds saying hello. Hinder sent me smiley faces and a heart. Thanks very much. Natalie Hawkins, hello, smiley faces and hearty eyes. Hi, Natalie. Jade Cook, hook me up with some veneers. It's not something I can just sell you. It's not like that. John Cover saying top bloke, keep the happy vibes coming. Thank you, John. I appreciate the support. Christian, tuna. You like tuna? I don't know. I like it. A little bit of mayonnaise, nice bit of rye bread. Bit of cucumber goes down a treat. Brandon Wilk wants a shout out. Big up Brandon Wilkie. Help, I've got bad gum disease. That's from Scott. Okay, do you have a dentist? If not, please see one. If not, see a hygienist or a therapist and they'll be able to assess your gum disease. A lot of it is taken care of by you at home. Don't smoke the ciggies, as I mentioned in my songs. Lots of cleaning in between your teeth with the brushes or flossing if you can't get the brushes in. And brushing twice a day effectively. Gum disease. Okay, Daisy Jarrett is saying, oh, I said about dinner, she had roti and curry. Fantastic, I'm pleased for you. Stain your teeth. Okay, Kylie Louise says, be my dentist. Where are you based? Come and see me. I'm in amazing Stoke in Hampshire. Natalie Hawkins, dental nurse here. No checkups for about 9 years. Enough said. Karen is saying, I think you had chicken wraps. I didn't, but that would have gone down a treat. Rocco, can I get a shout out? Big up Rocco. What's the best way to brush a baby's teeth? And we are done. That was 2 minutes and I'm not even anywhere near. Oh, my battery's run out. It needs a charge. What's the best way to brush a baby's teeth? Okay, it is quite difficult, but it's important. And I'm glad, Lauren, that you're actually trying to brush your baby's teeth. It's very important to try and get something in there. Even if you were to get a little bit of gauze around your finger and just the tiniest little bit of just like a little smear of not a lot, just even a little smidgen of something, toothpaste, if this is when they have teeth, and just kind of just even get your finger in and just rub it gently on their teeth. You're getting a little bit of fluoride on that area, which can help a little bit. I'm talking minuscule amount, not a lot of toothpaste, but it's really just they're getting something in their mouth and just kind of get them used to it. And then you build up and then you get these really soft baby brushes and then you can kind of get that in. There are these little chewy brush things you can get and they kind of just sort of chew them around. So it's just a case of trying to introduce the whole process and doing it like routinely. So, and let them watch you brush your teeth. So then it's sort of, they see mummy and daddy doing it and it kind of seems like a normal thing then to get a toothbrush in your mouth. So that's what you can try. That's what I did with my 3-year-old daughter. And now she loves brushing her teeth. Twice a day we do it together. She brushes daddy's teeth, I'll brush her teeth. And it's become a norm. And she won't go to bed now without brushing her teeth. Even if I forget sometimes, she'll say, Daddy, go brush teeth. And we go and brush them teeth. So that's great. All right. I'm so behind on comments. It's unbelievable. Can I book an appointment, please, for tomorrow for 2:30? Paul, you're a comedian, my friend. 2:30. Shout out all the dental nurses. I agree. Big up Fleur, who's saying shout out to all the dental nurses. Okay, right, let's go through. Big up Mia Dental Nurse. That's from Dawn Clark. I've got 20% battery. Low power mode selected. Ali Marshall. I've never been to the dentist and I'm almost 23. What might be a possible problem? I'll occur. Toothache, gum disease, abscesses. Hopefully you don't have any of those. You might know because you'll have pain. But Ali, don't avoid the dentist. We're there to help you and to help you to keep things clean in life and keep your teeth for a lot longer. So please make an appointment. Okay, shout out. My son wants to see you. That's from Mackenzie. Shout out, Mackenzie. I've got to go back to my dentist in a week about wisdom teeth needing it removed. Not looking forward to it. Like I said about wisdom teeth, go and have a chat with them and hopefully they'll make it nice and painless and easy for you. That is 14 minutes. We've got another few minutes left and I'm going to have to call it a night. Unbelievable. Jai Andrews wants to shout. Hello, Jai. How are you? Mike Gow's just joined in. I'm going to tell you something about something exciting coming in a couple of months. That'll be quite interesting. Sharpie saying long time no see. Hope you're well. I agree, my friend. Hope you're well. Okay, so from Kathleen, could you please give me some advice? I try and get my 19-month-old to brush his teeth, but he just keeps brushing his tongue. Please help. So I kind of just talked a little bit about how you can attempt to start trying to encourage the children to brush and just get something in there and just kind of work with them and let them watch you doing it. It's going to take time, but don't give up because these early stages are very important to get them used to the whole process of, you know, having a toothbrush in the mouth and get the whole kind of routine thing established. So keep going, Kathleen. You'll be fine. You can do it. I promise. Shout out to Luke Norman. That's coming from Vanessa da Silva. Big up, Luke. Hope you're well. Can I have good luck for my dental nurse exams Saturday 28th? Charlotte, good luck with your dental nurse exams. Have you done all of your ROEs? Have you? Records of achievement or whatever. ROAs? ROAs. I have to mark them for my nurse currently, and that's a joy and delight, isn't it? Anyway, Lewis, Facebook says, Facebook keeps popping up with adverts telling me to train to become a dental nurse. Should I go for it? Why not? If you enjoy dentistry, if you have a will to want to help people, it's a great profession. There's lots of things you can do as a dental nurse. There's loads of then things you can do to progress if you so wish. Dental nursing is a fantastic profession and we need it. It's part of the team. Like I said, I think any dentist you speak to will tell you how valuable the dental nurse is as part of the team. We practice what's called four-handed dentistry. And if you pay attention, I've only got two hands. So to practice four-handed dentistry, I don't just use my feet. You don't see my foot come up. No. My nurse, she's the other two hands. And it's a whole team effort. So we need our nurses. So yes, train to be a nurse. It's a great job. Okay. Hello from Bexon James. That's from Rebecca Barnes. Hi, Rebecca Barnes. Big up Bexon James. Okay. Deeper asking the deep questions. Yeah, that was quite good, wasn't it? Thanks. I'm really behind on comments, guys. That comment was probably made like 10 minutes ago, but it's just overwhelming with the massive shout outs and stuff. Can Spencer get a shout out, please? Ruth, I've done it, but I'll do it again. Big up, Spencer. Well done for being brave as a dentist. Hello from a third year dental student in Norway. That's from Anneli. I hope I said that right, but thanks for logging in all the way from Norway. Where is your practice? Do you need a nurse? I'm in Basingstoke in Hampshire, but we call it Amazingstoke. Lucian saying hello, how are you? How are you? Okay, can you get gas and air just before you have a wisdom tooth removed? Yes, you can. So, or even sedation, sort of IV sedation. So yes, wisdom teeth can be removed with gas and air, with sedation, just with local anesthetic, with general anesthetic. Like I said, Heather, this is like repeated. You're really worried about the wisdom teeth, aren't you? Listen, seriously, have a chat with your dentist. I'm sure they will, or whoever's doing it for you, they will put your mind at ease, I'm sure. Evening, Millard. Hope you're well. Any word on Craig David? How about diversity appearing in one of your videos? That's from Jamie. Craig David, I think he's currently like touring and super famous and looking forward to winning 1 million Brits. I am actually going to the Brit Awards. Oh yes, I'm going. And I'm going to try and grab Craig David at the Brits and say, bruh, let's do something. I've written Film Me and let's see what happens. But I'm going to the Brits and I'm very much looking forward to going. And hopefully we can find him there and finally approach him. Diversity, I would love to do something with diversity. I've even written something for them. But let's see. Okay. Here are we. You're a legend, says Jennifer. Thank you. Please give me a shout out from Chiara. Cal is saying, sup, dude. Sup. He didn't even write what's up. Just sup. Thank you. Senorita Rogi saying, how are you? I'm very well, thanks. Amira's logged in, one of my dancing dentist crew. Big up, Amira. Hi from Puerto Rico. That's from Kimberly. Hi from Puerto Rico. Unbelievable. International. I've never even been there, but it sounds wonderful. Mackenzie wants a shout out. Love you. Remember me from the last live, Camille? Yes, I do. Thank you for logging in again. I have infected gum around my wisdom tooth. Google pericoronitis. Pericoronitis. That will give you a little bit of information about it. I'm not usually a fan of patients Googling stuff and they come up with crazy diagnoses and treatments for themselves, but pericoronitis, that's when you get a little bit of gum around a half-grown wisdom tooth, can just get a little bit infected. You get some food going underneath the gum. You need to essentially flush that area out. Go see your dentist, they're able to clean it out for you. You can try a little bit of rinsing at home with some kind of warm, salty rinses. Just try and keep the area clean. It should usually resolve in about a week or so, but go see your dentist if it's really painful. It can be very painful. Pericoronitis. Okay, Grant, all the way from Philippines. Amazing. Emily wants a shout out to the Archway gang. Okay, big up everybody in Archway. That's close to Arsenal, and I'm an Arsenal fan, so big up North London people. Okay, bonjour from Connor. Bonjour, ça va? Ça va bien, merci. Cal is saying hello, how are you? Hannah's joined in, hi Hannah, how are you? Hi again from Cal, bonjour from Connor, shout out please, that's from Ashman King. Hi there, happy Tuesday from Kiara, hi, how are you? Would you recommend teeth whitening strips or are they really bad for you? The Crest 3D whitening strips, how often do you recommend them? The Crest, I've never had an experience with the Crest 3D strips. I know the American ones, because they have higher kind of rules for their peroxide concentrations they can use in America, they seem to work quite well because they're quite strong. I don't know much about what the UK versions are, but I know a lot of people that buy them off the internet from America. That is something I definitely don't recommend because you never know what you're getting. It could be a knockoff, it could be a fake, it could be something that's got a lot of peroxide or something else even in it, and it could be quite damaging for your teeth, make them quite sensitive. It can wear the layers away, it can burn your gums potentially. So I wouldn't advise you guys to use the ones off the internet. But the UK ones, I don't know. I haven't used them myself, so I can't give you a definite answer to say yes, are they good or not. And that's from Keeley. That's my honest answer. Okay. I have a physio at my work that looks exactly like you. That's from Tristan. Well, the physio must be a very devilishly handsome fellow. Speaking of which, I did say to you guys, I had a question last time saying, did you ever have hair, or what did you look like when you had hair? Well, ladies and gentlemen, hashtag Toothstay Crew, I'd like to show you what little Dr. Millard looked like when he had some hair. Booyah! Check that out. Oh, yes. I didn't just have hair. I had an afro. Oh, yeah. There you go. Yes. Feel free to laugh. Yes, I see all the laughing faces now running across the screen. Thanks very much. Where did it all go? It came down here. So one more time for your enjoyment. Little Dr. Millard. Enough of that. Thanks very much. Right, guys, I've got to call it a day. I'm so behind. I'm sorry. Let me speed through these. Luke Norman, can I get a shout out? I've done that already. Are you Turkish? No, I'm not. I'm from Iran originally. So Persian. I'm Persian like the carpet. Can you sing Apple Pen? I don't know what that means. Rumor, big up. Are you Turkish? No, I'm not. Just answered. Song, please. Nahida. No time for a song, I'm afraid, tonight. Sorry. It's Wednesday here at the moment. I'm in the future. Yes, you are, Amber. Yes. Hello, can you pronounce my name? Kiara? Is that right? Kiara Hughes. I hope so. Jordan Jeffrey, shout out from Plymouth. Big up the Plymouth Massive. Best dentist in the world from Lucian. Thank you, Lucian. You're very kind. Anne Breen wants a shout out. Big up, Anne Breen. Hello, mate. You are very talented. That's from Maria. Thank you, Maria. Please shout out. I ask every week, but nothing. Big up Melissa Moore from Fort William Dental Practice. Booyah! James Martin wants a shout out. James and Rebecca, you're welcome. My wife is now watching. She's finally turned off Celebrity Big Brother, and she's now watching this, and I'm hearing myself in the other room. Can you turn it down, please? It's very off-putting. She's laughing now. Seriously, I can still hear it. Anyway, right, where are we? You helped my little girl too when she had a back molar out. Oh, thanks. Thank you, Jennifer, for sharing. That's nice. Mojtab was logged in. Hello, my friend. Thanks for logging in. You're only 23 minutes late, and I'm about to log off. Shout out Station House Dental Practice in Glossop. Big up Jade and everybody at Station House Dental Practice. Naomi wants a shout out. This is literally all I'm doing tonight. Shout outs and wisdom teeth. That's it. Thank you, Be So Chuff. You're welcome, Ruth. Thank you for all your support. Fleur wants a shout out to Bridge Dental Practice. Shout out to all the girls at Tower Cross Dental Practice. That's from Samantha. Kiara, much love. Did I get your name right? Hope so. What's the difference between an orthodontist and a dentist? Dentist does teeth, does general stuff, does a bit of everything, can do surgery, can do a bit of braces, everything else. Orthodontists are specialists in braces. So they're still dentists. You have to be a dentist first, but then you do extra qualifications to become an orthodontist. And that's a specialist in braces. We also have endodontist. That's a specialist in root canals. We have periodontist. That's a specialist in gums. We also have prosthodontist. That's a specialist in crowns and bridges and dentures. Did I miss any out, guys? If I did, my industry people, I apologize. Perio, endo, pros, orthodontist. I think that's it. Pedodontist. That's a specialist in children's dentistry. Okay. You are much well known in my city of Karachi, Pakistan. Everyone adores you here. Wow, thank you. That's from Hardy Mustafa. I'm big in Karachi. Thank you very much. Tom's joined in. Thank you, Tom. Tom is the man responsible for helping put together this wonderful piece of work here, the Singing Dentist calendar. Guys, I'm going to do another shameless plug because we are raising money for Great Ormond Street. I know that's backwards, but Great Ormond Street Hospital. These are nearly all gone. There's only a few of these left. And I'll be visiting Great Ormond Street in March, and I would love to take them a big fat check from Singing Dentists and everybody that supported buying these and buying the mugs. Singing Dentist mugs. These, I've literally got about 15 left. It's not even a joke. And I was even going to try and keep some behind in case I smash mine, but everyone's been so supportive in buying these up, so there's not many of these left. And these, we printed a lot, and there's not many left. So guys, if you'd like to get your hands on them, www.singingdentist.co.uk. Help support the cause, Great Ormond Street. It's a fantastic cause, and I really want to support them as much as possible. So March, I'll be going to see them. So get them. www.singingdentist.co.uk. Right, I really don't think I'm going to be able to catch up with all this. Connor wants a hi. He said hi like a million times, so big up Connor. Gems Peds says hey. What toothbrush do you use? I use the Philips Sonicare Diamond Clean because I like it. It's also a good brush. Okay, there is just so many comments here. I'm never going to be able to catch up. I'm so sorry, guys. If you want to ask me something, please private message me on the Singing Dentist page. I will definitely get it back to you. I always do my best. After these Facebook Lives, I have like a million messages, but I will do my best to work my way through them. Norway, that's from Steen Marie. Wish you were here in USA, that's from Bara. Thank you very much. Ethan saying top man, I appreciate it. Biceps, that's why I'm wearing my top. I'm gonna do some workout in a minute. Get my gains on for 2017. Lizzie saying hey, can I have a shout out please to my best friend David and boyfriend Ross. Big up all your crew. I'm never going to catch up with all these comments. It's unbelievable. Literally, there's so many comments. I really appreciate the support, guys. I've got to love you and leave you, I'm afraid. Look at this. I'm scrolling down. I mean, I'm overwhelmed with the support today. Seriously, I'm so sorry I've missed so many messages. What can I say? Look at it. I'm still reading. I'm trying to read all the messages. There's so many coming in. Listen, if I missed you out, I really apologise tonight. I've seen Lewis just logged in. Lorraine Lawrence saying cute. Thanks. They're kind. All right, listen, I've got to go. Honestly, I'm going to read all these. I'm going to try so much to reply to you guys. Please hit me up. Melbourne Dental again. I've got someone from Australia logging in. It's literally, I'm overwhelmed. Honestly, thanks. I've got to call it a day. Instagram, make sure you follow me on that, @DentistSinging. I'm going to continue posting little snippets of what's going on in my life. And thanks again for your support. Same time next week, Tuesday, #Tuesday, 9:30, more dental questions. And I'll try and keep up with all the shout outs. There's been so many tonight. It's still going. Look, I'm scrolling and they're still just pouring in. Thanks for all the smiley faces. I'm going to give you what everyone wants. A little bit of eyebrows. And a little burst of return of the plaque. There it is. Return of the plaque. Oh no. Return of the plaque. Oh my God. I knew that it'd be back. Look at the blood. Thanks very much. Good night. Much love. God bless. See you next week.